Hello and welcome to my channel. October is Dysautonomia Awareness Month, so in honor of that, I wanted to make a video discussing what dysautonomia is, the different types, the diagnostic process, treatments, etc, etc, etc. This month is very important to me as I have a form of dysautonomia called postural orthostatic tachycardia syndrome. It impacts my everyday life and is a very misunderstood condition that deserves much more awareness. With that, let's start the video. So what is dysautonomia? Dysautonomia is an umbrella term used to describe different conditions affecting the autonomic nervous system. So what is the autonomic nervous system? The autonomic nervous system is responsible for regulating functions within the body that are autonomic in nature, aka the things you don't have to think about. So things like heart rate, blood pressure, temperature regulation, pupil dilation. These are the things that simply happen. So when your autonomic nervous system does not function properly, it can cause debilitating symptoms. Now, there are 15 different types of dysautonomia, the two most common being postural orthostatic tachycardia syndrome and neurocardiogenic syncope. Some of the other types are autoimmune autonomic ganglionopathy, pure autonomic failure, orthostatic intolerance, and the list goes on. If you'd like to learn more about one of the conditions I just mentioned or some of the other conditions, I will leave some resources down below. These subtypes can also be separated into 3 different categories: primary, secondary, and idiopathic. Primary, meaning we know that autonomic dysfunction is the main disease. Secondary, meaning it is being caused by another disease or condition. So for me, my dysautonomia is caused by my Ehlers-Danlos syndrome, a genetic connective tissue disorder. And idiopathic basically means we don't know what the root cause of your issues are. Since multiple body systems are being impacted by this disease, it can cause a range of differing symptoms. It can impact your cardiovascular system, causing symptoms such as tachycardia, fast heart rate, bradycardia, low heart rate, blood pooling, palpitations, chest pain. It can also impact your gastrointestinal system, causing symptoms such as nausea, vomiting, diarrhea, constipation, reflux, and the list goes on. There can be many different symptoms with this condition. With all this information, how is dysautonomia diagnosed and treated? The diagnostic process can be long and stressful, but in terms of diagnostic materials, the most common test is called a tilt table test. This test is done to see how the body responds to different positional changes. So blood pressure and heart rate will be closely monitored during the test. And periodically, a nurse will ask you how you are doing and how you're feeling, just to see how your symptoms are correlating with the values associated with the test. So like how high your heart rate is getting, or how low it's getting, or how it's correlating with blood pressure changes, things like that. It's not the greatest test in the world, but it can definitely help in getting the answers for why you're not feeling well. Other tests often prescribed or offered during the diagnostic period include things like Q-start testing, skin biopsies, the Valsalva maneuver, but oftentimes dysautonomia other conditions have to be ruled out before the diagnosis of dysautonomia can occur. In terms of treatment for dysautonomia, there's no known cure for this condition, and treatment is primarily focused on symptom management. The first line defense in treating dysautonomia is often lifestyle changes. So things like adding extra salt into your diet to help keep your blood pressure more stable and to also help increase blood volume. The same goes for water intake. It can do the same thing in increasing blood volume and also helping to keep blood pressure more stable. And then as you progress in treatment, exercises will be implemented to help in the process. The most common exercise protocols are the Levine protocol and also the CHOPS protocol. You'll often see those two exercise programs talked a lot about within the dysautonomia community. Besides lifestyle changes, medications can also be implemented to help in managing one's symptoms. So some common prescriptions are things like fludrocortisone to help increase blood volume, midodrine to help increase blood pressure. Beta blockers are often prescribed to lower one's heart rate. Pyridostigmine or mestinon is often prescribed to reduce the breakdown of acetylcholine within the autonomic nervous system. A newer type of treatment is IV saline infusions. There's not a whole lot of research behind why it's so helpful, but it can be very beneficial for people who are more sensitive to medications and are finding it more difficult to find the right combination of meds to help with their symptoms. It's also a really good option for people who have a lot of GI issues and are more chronically dehydrated. One thing I'd like to mention about a condition like dysautonomia is that it takes time to find the right combination of medications and the right regimen that works with your specific symptoms. It is also important to know that no two people with dysautonomia will experience this condition in the same way. One person may be able to manage their symptoms with simple lifestyle changes, and another person may need to take a more aggressive approach using a combination of medications and IV infusions. However, your treatment looks, you are valid in your experience. And that is a little bit about dysautonomia. I hope you enjoyed watching this video and I hope you learned something. If you want to learn more, I have links to some resources down below that you can look into and learn more about this disease. Thank you.